Welcome to our provider information session for state-funded contracts for county realignment. We welcome you today. It is just after 2 o'clock and we want to be good stewards of your time and go ahead and get started. My name is Beth Lackey. I am the Provider Network Director. I want to do a quick spot check to make sure people can hear me.
Yes, we can hear you.
Yes. Thanks, Charity.
We can hear you.
Okay, great. Thanks so much. All right, this is our information session regarding state-funded provider contracts as it relates to our county realignment. I'm going to go through our agenda today. We are going to talk about member eligibility and enrollment for state-funded contracts. We're going to talk about transitioning members for our September 1st go live date for Cabarrus, Stanley, and Union counties. We're going to talk a little bit about state-funded provider contracting and the role of the provider network account specialist at Partners, and then actions to take now. We are recording this presentation today and we will send this for posting on our website so that you can go back and look at this information after the fact, or if there are any questions that you might have after we have the presentation today. So we have a member eligibility and enrollment team at Partners, and their role is looking at the enrollment request for state funds, or as we've called it for years, IPRS funding submitted by providers. We have a special project enrollment form process, and that's specific to our hospitals in case there are any hospitals on this call today. And then our member eligibility and enrollment team works with providers on any client update request and discharge requests. They work on and process through and manage our court-ordered multidisciplinary evaluations, or MDEs for short, and our forensic evaluations, as well as any medication requests. So this team is part of our call center, Access to Care. And we want to give you some information regarding our transitioning, specifically for ACT, Assertive Community Treatment Team, or daily services for those state-funded recipients. So for all members that are receiving state-funded daily services or ACT team services, we're asking that you fully complete the enrollment form and submit that to us by August 27th. This includes those state-funded only members and members with active Medicaid Direct, but they're receiving an enhanced daily service that requires a state funding layer. So we're asking that you get that enrollment information to us by August 27th. And you have two ways to get that information to us. Either through a fax line at 336-835-2075, or through secure email as another way at our eligibility enrollment email address, which is listed here. Our deadline really that we're shooting for is by August 27th at 3 p.m. on that Friday. And then after September 1st, we would ask that you submit any enrollments through the Alpha MCS system. So these are these enrollments that would be prior to getting that in the system or getting connected to Alpha. And we will make sure that we do question and answers at the end so we can keep track of those and build out our FAQ as we move forward. through the presentation. We do have the form located as well as information on our county realignment webpage. And we do have a slide letting you know that this is the address for our county realignment. And we've added a tab here. So when you go to this website or this web page, if you will, you'll see members here, and then you'll see providers here. And we have our information sessions for registration purposes here. And then we've added this state funded service eligibility and enrollment information here on this page. So you're not trying to go back and find this information after the fact. So for those state funded recipients receiving outpatient services, if they receive basic outpatient services, we're asking that you submitted an enrollment form in the Alpha System enrollment portal at the recipient's next scheduled office visit with the updated demographic and financial information. If you need a login to be set up in Alpha, we have a contact at our help desk to get you set up in Alpha. And then we have information on our Alpha MCS portal so that that login is available. We also have information on our website for additional Alpha training as well. So a couple of things about our state funded eligibility requirements. To qualify for state funding, that household income for the member must be 300% or less of the most recent federal poverty guidelines based on family size. If the member's household exceeds income limits of this amount, then the member is not eligible for state funding. We have posted the information, or it's available at this link at the ASPE.hhs.gov poverty guidelines. So these income guidelines don't apply and are waived for crisis or emergent events, traumatic brain injury, or for our intellectual or developmental disability population. We did want to make that clarification. Some other important notes about financial eligibility is that we're asking providers to attach eligibility documentation to member documents in our Alpha System so that you're able to, when they're available and are provided by the member, so you're able to upload that. And the documents that we're asking to be uploaded are as follows: a state issued driver's license or ID card. In the event that is a minor, then the parent or legal guardians will suffice, a social security card, and then income verification in the form of a member's pay stub, tax return. If there's no income, a statement that's signed and dated saying that there is no income, and making sure that they're attached and uploaded upon that initial enrollment, and then annually updated thereafter at the client update request for the annual state funded benefit plan. State funded eligibility and requirements for financial eligibility are also that providers can upload these documents to a member's record after an enrollment has been approved and that record has been created. That's available in our patient maintenance module under clinical documents, eligibility documentation. And it's important to note that if a member has existing record in Alpha, you don't need to wait until enrollment has been approved to attach that documentation. I wanted to also point out our eligibility and enrollment email. We have Becky Ford as our eligibility and enrollment supervisor, as well as additional staff that can be of assistance to you through this transition. So for those state-funded recipients that are receiving outpatient services, we want to make sure that we're facilitating timely access to services. We would want to make sure that you're able to complete that information in Alpha, and for those members within 7 calendar days of admitting or seeing or assessing that recipient. We have posted in our provider operations manual that information on pages 101 to 105, so that if you need to go back and reference after this presentation, our provider operations manual is available in our provider knowledge base. For those of you that are new to us, our provider knowledge base is an area where we try to make sure that we're adding information consistently for providers to go back and reference. And our operations manual is something that we keep up to date. We update that manual quarterly, and we have this information as a resource for you to go back to. The client update request in Alpha, all requests for changes to a currently enrolled member's record with an active state funding must be made by submitting that client update request via Alpha. They cannot go back further than 90 days from the date of submission, and we retro those back for 90 days. The state layer funding effective dates cannot be changed outside of that 7-day enrollment period rule. So we want to make sure that you're able to get the information into the system. You have that 7-day period to do that. And we want to make sure that we're working with you to get those updated. We want to make sure that providers are submitting your discharges monthly using Alpha's discharge modules for members who are no longer receiving services. And these are reasons in the disposition where they've completed services, they've refused services, that maybe they moved, they transferred, they're no showing, and you're discharging them from your system, unfortunately, they may have passed away through this process. There are other reasons on the discharge reason drop down. So when you're creating the discharge, you can submit your information and the required areas are noted with a red asterisk. So if the discharge reason is other or unknown, we do ask that you put a comment in the system so that we do understand that. Our substance abuse or substance use members, there are additional SA fields or boxes required. So we've tried to make that information as clear as possible so that there's not missing information through that process. Again, we want you to have the ability to do this, and we're willing to work through this process with you. We know some of you are already connected with Alpha, have experience with Alpha, and we know some of you will be using Alpha for the first time. So we want to make sure that you have our eligibility enrollment group email address, as well as some live people to work with you, our eligibility and enrollment supervisor, Becky Ford, with her phone number included here, as well as Debbie Eldridge, the program assistant. And this just gives you a bit about the way in which we have our structure for our eligibility and enrollment department, which again is an arm of our access to care department. So a little bit about the state-funded provider contracting process. So Partners manages state-funded provider contracts for single-stream dollars through capitation amounts in contracts. We've done that different ways through the years. We've sought feedback on that process from our provider council, and we currently manage that through capitation amounts to make sure that we are able to manage the limited funds for our single stream dollars. So we look at those expenditures and utilization as a management tool for how to look at those dollars and expenditures to make sure, number one, that we maximize those limited state funds on an annual basis. We review it on a monthly basis, and then make sure that for providers that may have underutilization, that we're looking at how do we potentially use those dollars in a different way, or look at overutilization to see where there may be additional pressure points or needs as we move through the process in any given fiscal year. We have provider relationship management is the unit of provider network that is your account specialist. Sherry Reese-Coda is one of our regional managers in provider network. And she manages our account specialist. I've listed them by name here. And we also have, as you are assigned a provider network specialist, then you have the ability to go to our website and then be able to find your assigned provider specialist. So the role of the account specialist is really to help you work to join Partners Network, to be able to connect with somebody that you can ask questions, to be able to find out where you are in the process of joining the network if you're not sure about that process or how that process is going or whether there's follow-up needed. And then we also have a group email address so that we're not missing emails at our PAS@partnersbhm.org, so that you're able to make sure that staff are being responsive and are able to answer your questions and work with you throughout this county realignment and transition to get you connected, answer your questions, and work with you for a successful transition September 1st. A specific account specialist is assigned to work with our agencies and licensed independent practitioners. That is inclusive of our state-funded contract providers. We have a phone number so that you're able to dial by name. We also have a help desk function, and then our group email distribution, so that we're able to make sure that you're able to reach someone so that you can get your questions answered or any barriers or opportunities that we have to resolve quickly as we move through this process. Our state-funded providers are assigned account specialists to make sure that we are having funds aligned properly in your contracts. Add funds based on any member or recipient need, and working with those that are underutilizing to move dollars around, or addressing any barriers or opportunities if we have overutilization of those services. So really they want to make sure that we're able to work with you to maximize those dollars, but also be mindful of that. The dollars are very limited as far as our single stream dollars. So we want to make sure that we're able to maximize that and address any questions that you may have. So what do you need to do now? We want to make sure that we're working with providers that are serving members, that are wanting to connect with partners. We are working through the Cardinal Innovations directory, but also have been working very collaboratively with our colleagues at Cardinal to have critical information regarding members who are authorized for services, as well as providers who have claims since February. So we've taken those lists and been able to crosswalk those to make sure that those that are serving members and have submitted claims that we're able to get you into the network and contracted with partners to get those in place. If you have not been contacted, or maybe someone contacted the wrong person in your organization, please email us, reach out to us, call us, let us know that you haven't heard anything, or you don't know where you are in the process, or getting us to the right person so that we can make sure that we're ready for our 9/1 transition date. If you're not currently contracted with Cardinal or are not part of the network, just in case we have those providers on the call because you're interested in learning more about partners, we do have an information to fill out some information for us to be able to connect with you called a request for consideration form on our provider knowledge base, so that you're able to give us some information so that we can reach out to you to be able to start that process. A couple of things that we want to make sure, we do have an enrollment arm that is different from member eligibility and enrollment in our provider network department, where we work to ensure that provider information is in NC Tracks, and that we also make sure that as you're beginning to work with us, or as you're adding sites and services, that you're also have your information up to date in Alpha. So we verify in the provider network enrollment unit that you're credentialed with partners, that you're enrolled in NC Tracks, excuse me, and that if you're credentialed and enrolled in NC Tracks as part of that credentialing process, then we enroll you in Alpha and your written contract will be issued. So those are the steps that we want to make sure that you're connected with NC Tracks, that you're credentialed with partners, and then we are then able to verify that and make sure that you're enrolled in Alpha so that we can issue you the written contract, which we use and submit through DocuSign. So if something goes awry in that process, then we send you an enrollment status letter with instructions and next steps to help you through that process. If you have questions, we have a group email address. It's always better to have group email addresses instead of it being in somebody's email somewhere. Danielle Clark is our enrollment supervisor. We have her direct contact information here on the screen, or you can send it to the group email address so that we're able to help work through any provider enrollment questions that may be coming up, or that you're encountering something that may be challenging. All of that information that I just shared about your enrollment and your contract being issued ties into your being able to submit those claims, so that we can make sure that we're paying you. And that is of utmost importance to partners, that we're able to have you contracted so that you're able to continue to serve members, and that you're able to get paid for the good services that you're doing, so that we're able to work through all of those steps in the process with a commitment to make sure that we're paying your claims that you're able to submit. So we want to make sure that you're submitting those claims timely, that you're not holding your claims, and then also working your claims denials in a timely order so that we're able to make sure that we're correcting anything that may be coming up, because our goal is to make sure that you continue member continuity and member care, and that you're paid for that good work that you're doing. We also have a training arm of our provider network department. Carolyn Schoaf and Michelle Strobel are our two provider network trainers. Training at partnersbhm.org is where we offer trainings on a regular basis. And coming up next Thursday, and I would encourage anyone that's new to Partners or just needing some help with anything that may be relevant to your work with us, that you would sign up for our virtual provider open house. We offer that as a standing meeting on the first Thursday of each month. And we actually do breakout sessions. We have opportunities for you to do some one-on-one with various subject matter experts so that we're able to make sure that we can resolve any issues that may be coming up, or work with you on any challenges that may be occurring. I did want to make note, and I've said this at each of our training or each of our information sessions, that we have standard meetings with our monthly provider council, our current provider council, and as we go through county realignment, we're looking at that. We have an open meeting the fourth Friday of each month. Prior to COVID, it occurred in Hickory. Now we are Zooming, as you might imagine. That next meeting is the fourth Friday, August 27th. That is the providers meeting. Again, it's an open meeting, and the provider council meets at 9:30, and then partner staff, including myself, are invited to attend that meeting around 10:30 to then be able to work collectively as a group to resolve any issues that may be coming up, or have feedback from the provider council. We use that group as a way to seek feedback about issues that may be occurring in the network and opportunities for us to partner together to resolve those issues. We also have a licensed independent practitioner collaborative. So for any of our licensed independent practitioners on this call, we do that every other month from noon to 1 p.m. Our next occurrence of that is August 18th and November 17th, and would love to have any LIPs that are on the call today to join us for that. We also offer a quarterly webinar with our providers, where we try to make sure that we're getting information that's critical to you in the form of a webinar on a quarterly basis from 1 to 3. Our next one is September 8th. And then again, August 5th, next week, is our 9 to 11 provider open house. This is a virtual meeting, and we want you to be able to register for these opportunities for us to continue to share information. So I'm going to pause. That was a lot of information, but we really wanted to make sure that we're able to get to the questions and answers for today's meeting. So I will stop talking for a minute and make sure that we're able to answer any questions. So the first one that we have is about the enrollments, and does that include SACOT as well, because that is a daily enhanced service. So I'm going to verify, I believe, if I'm not mistaken, Melissa Klein and Becky are on the call. So Melissa or Becky, do you want to take that and make sure that we answer that question? So they're asking for the enrollment that we're asking to be submitted on August 27th. Does that include SACOT?
Hi, this is Becky. We had not prior done SACOT for those forms, fax forms. Those had been coming through the Alpha portal.
Okay.
Okay.
Okay. So if I'm hearing you correctly, Becky, then SACOT would be submitted then at the members next time that they come in and should be submitted through the Alpha portal. I just want to make sure I state that correctly.
That is correct. And what I'm going to do in the chat box also, I'm going to send the link to that page that they have set up. And hang on one second. Let me. Okay. And if y'all look at this page, I just sent the link through the chat box. I just want to be sure that y'all can find the form. When you click on that, if you go down, there is a green line that says County Transition Member Enrollment for State Funded Form. If you click on that, that'll actually pull up the form that you would use to fill out and submit for the ACT Daily Services. And they do have drop-down boxes in that, and it's an interactive form. And I kind of suggest maybe you just want to bookmark that so it's easy for you to find as well.
Thank you, Becky. Another question that we have, I see you, Marie. You're always my partner in showing your face on the Zoom. So welcome and thank you for always participating. So Marie's question is, ACT or daily service the same as LTC? Tell me, Marie, what LTC stands for. I may just be dense this afternoon. Oh, wait, unmute yourself.
Long-term, B3 long-term community support. So I didn't know if that was the same thing. I was just trying to get it.
No,
Okay.
it is not. So it's for ACT, assertive community treatment team. So that enhanced service for our ACT team. And then a daily state funded service. So long-term community supports wouldn't fall in that category.
Okay, thank you.
Sure. Okay. Thank you all. There are references that Michelle has included, as well as Carolyn, in the chat so that you all would have easy access to the link. And again, we take these chats and create FAQs out of them. So we appreciate you all sending this information and asking the questions through the chat. So I have another question coming in. Are the financial eligibility documents required for inpatient SUD services if the member has no income? So Becky, thank you. I see you unmuting.
Yeah. So are you talking like an FBC or a hospital, or this sounds like this might be more of a crisis event. Is that correct?
Yeah, I want to make sure that we answer that. Larry Joe, I'm picking on you because you asked this really good question and want to make sure that we answer it correctly. So are you referring to an inpatient SUD for like facility-based crisis or a crisis service? We want to make sure we answer you properly, Larry. We'll get some further clarification on that. Becky.
Well, I will say that if it is like a facility-based or a hospital admit, if it's like of a, urgent crisis nature, then no, we will not require those if there is no income. Okay.
And Larry's saying it's relevant to YP 770 services and that it's treatment.
Okay, I would have to look at that service code. It's off the top of my head, I'm not sure what that service code is.
We'll get that question answered, Larry, so that we can get that posted. And thank you for putting the CPT code in. That, if I'm not mistaken, is a daily IDD service, if I'm not mistaken, but I could be wrong.
It is a residential service, but it can be MHSU or IDD.
Gotcha. I gotcha. Thank you, Charity. So we'll get that, Larry, answered. That's no problem. I understand. My microphone was blaring earlier, so I appreciate you letting me know. But we'll get that and circle back to getting that posted, Larry. What other questions do you all have? I've got a new message. Does the August 27th enrollment include ADVP?
Okay, what is ADVP?
It's an IDD daily service. So if I'm not
Yeah.
mistaken, Becky, it falls into the daily service.
Yes,
Right?
yeah, that would, yeah, so that would be included in that.
It's a periodic service. Does that make a difference?
I'm sorry, it's a what?
It's a day service, so it's a periodic service.
Okay, so it is not a daily service?
No.
Yeah, we're trying, because I have a feeling we'll get quite a few of the daily services in. Anything that is maybe once a week or something, it will be upon their next visit, their next session, that would be enrolled through Alpha. So any of the more, daily services that need the authorizations in advance, to be prepared to have an authorization in place, we will do the manual entry for those daily services.
So Becky, are you saying that for ADVP that you would request that they submit that enrollment by the 27th?
Well, since it's not not a daily service, it's an intermittent, every so often service, effective September 1st, they can submit that through the Alpha enrollment portal.
Let me clarify.
Okay.
So ADVP is a day habilitation service. So a member may go 1 day a week, they may go 5 days a week. It depends on their need.
Okay. All right. I am not familiar with that service. I will say if they go 5 days a week, then if they are receiving services that often, yes, go ahead and fax the form in. If they might be receiving services just 1 day a week, then probably need to have that enrollment put through Alpha. However, if y'all do fax the form for a member like that, we will go ahead and process it for you.
And we will make sure that we clarify that. It sounds like we need to make sure that we need to clarify that in the service code so that it's clear on the services. But I think, Gary, to Becky's point, if you want to go ahead and fax those enrollments to have our staff be able to have those already in the system, then you can do that, I think is what Becky's saying. What other questions do you guys have? These are great questions. The questions are only going to make our correspondence and information that much stronger. Okay, Amber, I want to make sure if you have a question that we're able to answer that. And you may be typing it. I just want to make sure that you're welcome to unmute and answer or ask your question. Oh, she's got it. I'm just ahead of her. Thanks, Amber. If we have members inpatient here at ARCA who are here the day you take over those counties, do we do enrollments for the day you take over? So Becky, I think what Amber is saying is that if there are members that are at ARCA on August 31st and they are going to still be at ARCA on 9/1, then when would they do the enrollment? Do they go ahead and do that enrollment? How do they need to process that?
Yeah, well, they would, if they're at ARCA, they would need to, on September 1st, go ahead and put in an enrollment through Alpha. Of course, we cannot, Alpha does not allow us to predate anything. So we cannot enter anything into Alpha until 9/1. And I'm just going to go back a couple questions ago. I did look up the YP 770 code, which is group living moderate. And I would say, yes, those would go ahead and use the form to fax or email to us for enrollment for that service code.
Thank you, Becky.
Mm-hmm.
Okay, great. I'm glad we answered your question, Amber. What other questions? And you guys don't have to always type it in, but wanted to make sure that we're able to get these questions answered for you. All right, Dee is sharing that their agency completed the online form to submit for YP 770. So you've already done that, Dee?
Hello, great people. Yes, we submitted the form online. So it wasn't one that we had to fax or email in. It had an automatic submission straight to partners. So hopefully we completed the right link. It's what Dana's been sharing with us via Zixmail and other email sources that for you to complete for the state transition of funds. So hopefully that's the correct document.
And Dee, we'll double check on that to make sure you've got the right one and circle back for you on that to make sure, because I know we've been corresponding today. So we'll make sure that we'll verify that to make sure if there's anything else, then we'll reach out. How's that sound?
That sounds perfect. Thank you so much.
Sure.
And kudos to you guys. Your trainings have been just professional and clear and spot on, and everyone that we've made contact with has given immediate response, and if they didn't have an appropriate response, they connected us to the right individual. So kudos to everyone making this transition super smooth.
Thank you, Dee, for that feedback. And if there are things that we need to do better, please also let us know that as well, because we want to work with you on this transition, and we only get better when we're given not only kudos for continuing to do something, but also get information on things that we need to make sure that we work on. So we appreciate all of that feedback, but thank you, Dee. That's very kind of you to say. We want to, let's see, I want to make sure I read this next question. If someone is authorized for a daily service through 9/30, will that authorization be honored? Charity, I'm going to let Charity answer that for fear that I may say the wrong thing. How about that, Charity?
That sounds great. I appreciate you asking that question. If you have an authorization that is active on August 31st, you will receive an authorization from partners that starts 9/1 through the end of your current authorization.
All right, thank you, Charity. And Douglas says thank you as well. Great. What other questions do you all have? Sure, Amber, go ahead. That's what you're not limited to only one question. How's that?
We don't cut you off until 10.
Right. Which for some of the partners group, 10 questions is a low number, Amber, just so you know, you're in good company. I'm filling up space for you to type your question. How's that sound?
And let me say, I appreciate that she throws it in the chat that she has a question so that we know
Agreed.
it's coming.
Agreed. Is your alpha system the same as Sandhills? So that is a great question, Larry. We do have, if I'm not mistaken, when many of us, I believe, if I'm not mistaken, there were 6 of us that chose alpha. And so that base product for alpha has been the same. If there are modifications that Sandhills has done over time, there may be some nuances, but we all collectively used that alpha system, if that answers your question. Amber has typed her question, and then Terry, I'll ask your question. How's that sound? So we are a 21-day program, and client has already been here 10 days with Cardinal, and they become partners. We are going to bill remaining 10 days, and it's not going to be an issue. I'm just using 10 and 10 as an example. So I think I want to make sure, and then Charity, you can help me with the response. So you have an authorization for 21 days, let's say, as an example. The client has been there for 10 days at the time that the switchover happened. So let's just say, for argument's sake, August 21st, and then you build till August 31st, right? And then you still have that 10 days left in your authorization. And then your authorization would transition over, and that remaining 10 days would be what you bill. They bill once a month at the beginning of each month for the prior month.
Do you have an authorization with that service?
Oh, how do we authorize it? She wants to make sure that they authorize it correctly.
So I'm not sure which service she's referring to, because there are some services that are authorized a little different here at Partners. We are still learning some of those services, and we will put out a crosswalk if things change with those services. H0010 and YP780. So YP780 is group living high, I believe, and 80010, I believe, is supervised living. Did I get those right?
I believe we currently bill partners 21 days at a time, but don't with Cardinal.
So that might be something we need to talk about offline.
Mm-hmm. Amber, what we can do is we can look at that and see how we need to align that. I think it's a great question, but to Charity's point, we can set up some time where we can go through that. So we make sure that we are being consistent. And so we want to make sure that we're able to answer that properly. So we'll go ahead and work to get you connected and include a meeting with us and include UM in that. So we make sure that we're instructing you properly. And then we'll also give some additional guidance when we post the FAQ. And Terry, Terry's asking Charity to repeat what we said about authorizations. And Terry, what she's saying, and then Charity will correct me if I'm wrong, is that the question that she was answering was, if someone is authorized for a service through 9/30, will that authorization be honored? And Charity said yes, that if there is an authorization, an active authorization in place on August 31st. So in this example, there's an authorization through 9/30, that partners would honor that authorization through that time period that's already in place. and then you would submit the request for reauthorization at the end of that authorization period. Did I get that right, Charity?
Yes, and I just want to add something to it that I did not say before. Just like with enrollments, we cannot enter authorizations. So those authorizations will start going in on September 1st. We ask that you give us some time to get your authorizations in. We anticipate that it'll take about 30 days. So if you haven't heard from us in 30 days, or you're missing some things in 30 days, reach out. However, we will be working diligently to get those auths in during that time.
Thanks, Charity. What will be the limit of group living moderate authorizations?
So group living moderate is a daily service, and I don't know off the top of my head if we authorize it for 180 days or longer. However, I can put into the chat, and just give me a moment, the link to our benefit grids, which will tell you how long our authorizations are for.
All right, thanks, Charity. And that's a nice segue, Amber, to next week's information session on authorizations. So good tee up with these questions, because we're having a specific session dedicated to authorizations next week on the 3rd. So we're excited that you'll get registered from this meeting into that meeting. How do we show proof of current authorization to partners? Amber, we are working with Cardinal and have been working with them to get that information on member authorizations so that we have that in place. If for some reason something gets missed, then, then you can reach out to us, but we're working to make sure, and Charity can correct me if I'm wrong, that we already have those, that information to make sure that we're able to continue those authorizations.
That's absolutely correct.
Thanks, Charity.
We want to make this as smooth of a transition as possible, and are not trying to put additional burden on the providers.
And Diane, I saw your question about getting connected to Alpha. We do have a help desk through our IT department to get connected. And then Carolyn has actually added into the chat the login information on our knowledge base so that you can get connected to Alpha and have that information. So Amber says, I guess we would just do our auths like we have been, if you will have that information, and then do re-auths with partners after 9/1 is needed.
That's correct. So if your authorization or request is due prior to 9/1, you would submit it to Cardinal. For using the example that Beth had, if it was due on August 21st, you would submit that authorization request to Cardinal. Cardinal would then send us the even if it goes beyond 9/1, that's correct. And then Cardinal would send us that authorization in a spreadsheet, and we would take the remainder of the auth starting 9/1 and authorize it through the end.
Perfect. Great example. And Amber says, that answers my question. Excellent. Good questions. Really good questions. All right, guys, we have 5 more minutes. These are great questions. We want to make sure, I just scrolled back through the chat to make sure I didn't miss anything. We want to make sure we answer any questions that you all have. We want to make sure that you have adequate time. We know that questions are going to come up. Again, we are going to post this recording so that we're able to get this information out, and then want you to, if you have questions that come up after this training, making sure that you're able to connect with us. And I'm just going backwards a minute. Through any of our contact information, our provider network, account specialist, group email, as well as some of our information at the beginning. So Diane asked, it sounds as though there are lots of places and people to talk to in order to help us with this transition. And Carolyn has shared our help desk phone number. This is specific to Alpha, which is 704-842-6431. That can be used to get the login to Alpha. We also want to, Diane, to your point, we want to have a no wrong door approach so that we're able to make sure that you're, able to get connected. The provider account specialists work with our providers on a regular basis on a lot of these issues. And so if you wanted to start there, or you can start with any of the information that we've provided today. We really want to make sure that we're working with you to help cut down on any questions. We know that the transition is a transition. And we also know that there's a lot going on in addition to this. So we want to make sure that it's not a mystery or it's not a wrong place for you to connect with us. Also want to make sure we've got a couple of more minutes, that if there are any last minute questions, we want to make sure that you're able to ask those questions. Amber, good. She's like, I have one more. What is the biggest, while Amber's typing her response, Larry says, what is the biggest difference between Sandhills and Partners in the Alpha system? Larry, I'm not 100% sure on that. As far as the nuances that may be in place, I would anticipate, and this is just based on experience with other LME MCOs that have also used the Alpha system, that there were not tons of differences. So when we did this with Rutherford County, and we worked with VIA very collaboratively, and they had the Alpha system, there were maybe some small nuances, but I don't anticipate that those would be huge system setup changes. So I don't know that I fully answered that question without knowing Sandhill's system, but I don't anticipate there's tons of differences between those two systems. And that was perfect timing for Amber's question, which is, Detox auths with Cardinal and partners are really different, and we will need some clarification. That is helpful, Amber, and we will connect with you and include UM and Provider Network in that, and have a one-on-one with you to talk through those nuances, because I think it would be helpful for us to understand that.
Absolutely. And I will say that we are working on a crosswalk document that we will publish to show if there are services that they have maybe a different modifier on, or that they authorize and we don't authorize. We will be publishing a crosswalk document to give you like a little cheat sheet for those types of things. But we are working with Cardinal fairly frequently to find out some of those nuances, and would love to hear some of your information. So I look forward to talking with you.
Okay, that's helpful. Past 3 days are different, and partners requires documents that Cardinal does not when requesting additional days. So that's helpful, that level of specificity. Amber, we will get something set up with us so that we can make sure that we tease through those nuances. So that's helpful to note. These are great. I can't speak. These are really good questions, and we appreciate your time today so that we can make sure that we answered those questions. If you think of other questions, then please don't hesitate to submit them, because we are trying to make sure that we post those FAQs. And for those that we will follow up today to make sure that we tease out some of those nuances. We also ask that you register for the authorization training next week, so that we can make sure that we're continuing our provider information sessions. So thank you for joining today, and we appreciate your time.